for the echo today. It's 12 o'clock. We're going to go ahead and get started. Thanks for your patience. I'm Jody West, and I am the coordinator of PPCL. We're going to go ahead and this is the third session of the Echo Cohort 2. This is our agenda today, and we're going to do our best to stick to this schedule. We're going to go ahead and get started with introductions by Dr. Olivier, who is our facilitator, and then I'll lead us in the case presentation by Sienna and Caldwell. After they present their case, then we're going to open the floor for clarifying questions and any recommendations for the case presentation. Then we'll move to our presentation of the didactic, which is focused on screening for anxiety and depression in pediatric patients that Lisa Spence will be presenting for us today. And then we'll wrap up with announcements. So if Dr. Olivier can lead us in introductions, please.
Absolutely. Good morning. Oh, good afternoon, everyone. Last cohort, we did this in the morning. I'm Dr. Olivier. I'm a child and adolescent psychiatrist based out of Lafayette, Louisiana, over here in private practice. I am the facilitator for this ECHO session. And so I am the time management person who will try and keep us on the clock. It looks like we got a small enough crew today that we can make individual introductions. So I'm going to go through the list of participants and just ask to briefly introduce yourself, where you're located, and what your role is, whether it's social worker, doctor, nurse practitioner, etc. You already met Jody West, who is our coordinator. Lisa, you want to introduce yourself?
Hi, I'm Lisa Spence. I'm a pediatric nurse practitioner at St. Bernard Community Health Center. I do primary care and mental health. Oh, and part of the hub team or ECHO team.
Thanks, Lisa. Dr. Queen?
Okay, sorry, it takes me a second to turn my camera on. I'm Dr. Queen. I'm a pediatrician. I'm also board certified in obesity medicine, so I sort of do that as well. I'm one of the hub team faculty, and I have an extra special interest in mental health, and happy to be here.
Thank you, Dr. Queen. Tanya?
Hi, everyone. My name is Tanya Williams. I'm the Healthcare Innovation Manager with Well Ahead, Louisiana, and I'm calling in from Baton Rouge.
Thanks, Tanya. And I heard, Tanya, you have an intern with you today, Autumn. I saw her on.
Yes, ma'am. My name is Autumn Chasson. I'm an intern here this summer with Well Ahead.
Awesome. Welcome, Autumn. Sienna?
Hi, I'm Sienna. I'm a licensed clinical social worker and board approved supervisor, and I'm the mental health consultant for provider-to-provider consultation line.
All right. I saw Catherine Wise.
Yes, I'm an LPC with the Family Tree out of Lafayette. And if you can see from my background, see almost exclusively kiddos.
Thank you. Heather? I see a Heather Negrato. It's okay, she might be distracted. Let's see, I see a Lauren on the call. Lauren, you want to introduce yourself? All right, I will skip. How about Dr. Dixon? Nope. How about Rachel Taylor?
I think people are probably grabbing lunch and like listening with their earbuds. They're like, "What? They're calling me?"
So we'll just well, Rachel Taylor, you want to introduce yourself?
Hey, my name is Rachel Taylor. I'm a psych NP and I'm calling from Mamou today.
Nice. Welcome. Glad you can make it. We'll for the rest of the
I'm Dr. Olson. I was fighting with my audio. I'm calling from New Orleans.
Thank you, Dr. Olson. Welcome. So we'll just go ahead and put in your in the chat section the rest of your introductions, your name, where you're from, your credentials, and your email address too, because we're going to move into the didactic presentation, and Lisa is actually presenting.
I'm super excited about presenting too. Okay, next slide. So everybody knows that the new recommendations per the US Preventative Task Force were that we needed to start screening children 12 and up for major depressive disorder and for anxiety 8 to 18. The biggest issue that we found is that this has become, if you do a pay per pay program with some of the Medicaid programs, that they are requiring this as one of your requirements. You have to screen for major depressive disorder and for anxiety. And this is how you get reimbursement, right? And this is how you get all the money back that you've put into seeing these children. However, the outcomes are you may not have the resources to provide to get them where they need to go. So the guidelines have been that as pediatric providers that we can start treatment if it's major depressive disorder or if it's severe anxiety disorder, and starting with, something, and while they're waiting to get into therapy or see the psychiatrist. Next slide. And so in the abundant screenings that there are in the world, which there are a ton of anxiety and depression screenings, what screenings do you choose? So I took some of the most common and just said, these are probably the easiest to use in the amount of time as a pediatric provider with time management, and you only have 15 minutes or 30 minutes to see your patient, whether you're doing a sick visit or a well visit. These screenings have been probably the easiest to do, the easiest for the MAs to do, the easiest screenings around. The two screenings that are recommended by the US Preventative Task Force are the PHQ-9 adolescent or PHQ-9 modified for teens, and then the BAC depression screening. I can tell you, I don't use the BAC depression screening. I use the trial depression screening. I think it's, or the CES-DC, which is the Center for Epidemiological Studies Depression Scale for Children, because I like there to be two versions. But everyone has kind of their choice what they choose, but the one recommended for the 12 to 18 years old is the PHQ-9 modified for teens, which is a lot like the adult PHQ-9. There is a screening for parents to do for preschool. It's the preschool feelings checklist. It's not recommended, but it can be used, and it is helpful. And so next, and for anxiety screenings, 12 and up is the GAD-7. You can also do the SCARED, which is longer. It's many more questions, but it focuses not only on just different types of anxiety, it also focuses on like school separation anxiety. And that's the one I seem to use more often because I find it most of my kids that come in with anxiety have issues with separation anxiety or school phobia. And so we like to use that more often. And the SCARE can also be given to both the parent and the child, whereas the GAD can only be given to the patient or the child. There was a targeted group, and it's through 8 through 11. And I did not know that. That was a new thing for me to learn. But the two that are recommended by the task force are, of course, the GAD-7. I'm sorry, the SCARED, and then there's the SPIN, which is the social phobia inventory. And again, I've never used that screening, and it was a new finding for me because I just don't use it because I use the Scared. So I got to learn all about all these different screenings, and I was really overwhelmed. But I feel the two best screenings for the 12 to 18-year-olds are the, of course, PHQ modified for teens and the GAD-7. Next. So, and then I've attached the link so that you can see these screenings. I'm sure most of you use them in practice, but they are out there and available, and all of these screenings are free, which I like. Some of the other screenings are not free, so they're more difficult to find. So, but these are all free. So I think there's one more slide. And then I put the billing and coding in for screenings because these are billable codes, and I think that's helpful, you know, just for reimbursement purchases. And yes, I can put those links in the chat for you also. And that's really it. If you have any questions.
Can you go back to the slide that has the links on it for a second? Yeah, that one. Thank you.
We'll send the slides to everyone too. So if you don't want to write those down, that way you can have access to it.
I'd like to know from the pediatricians out there, what screens you guys are using, if any, and how feasible is it? Like, because I know y'all do so much, and y'all got, you're not only looking at development, you're also screening for lots of different things. But what are y'all doing out in practice?
I use a PHQ-9 and the GAD-7 for everybody 12 and up.
Awesome.
And for 13 and up, I do a craft also.
Awesome. And what happens when it's positive?
I have a list of counselors that I use if it's an emergency, obviously to the emergency room, but normally I have this little smart phrase that's like a lifestyle plan on, relaxation and nutrition and all the basic things. And then we meet back in a month or so and see if they're getting better just with those lifestyle things. And if they're not, then I really push them for the counseling piece.
That's great. With the counseling piece, does your clinic put that list together for you, or are you having to do that on your own and keeping it up to date?
We've done it together. I do have a family support worker here that helps to dig through that stuff. And then I use different lists that I've gotten from different pediatricians around New Orleans. I don't know if they're all up to date. I'm not going to lie about that. I also use that Psychology Today website.
Yeah, that's a great resource.
I like that you do a follow-up in a month, because I think a lot of providers just kind of give the counselor and say, here's your counselors, and we'll see you back for your well visit in a year. And I'm like, well, that's not good choices. So let's bring them back. Let's see them again. Just check in with them again, because they might be doing better in a month, because I feel like teenagers, especially, they change every week.
Absolutely. I mean, a lot of times, truthfully, they score themselves worse in a month because they're actually now starting to think of it. Nobody's ever asked them the first time we do the form. And so I feel like sometimes they just become a little more attuned in themselves. And when I first started that, I would get very disappointed and think that I really messed the whole thing up. But I think that if you give them a little time, then they really can work through it.
Yeah, I like that.
Mm-hmm.
One thing I think is really helpful that I do, because I'm in Bogalusa in my pediatric clinic, and there's only really one place that will see kids that we trust. And I know it's going to be a couple of months before they start therapy. So there's an app that you can get as a provider. You can sign up for it. It's called Spark RX. I'll put the link. And you can sign up, and then you get your own personal code that the patient downloads the app. And it's a 7-week cognitive behavioral therapy program designed for teenagers with depression. Specifically, it says it's for depression. I'm sure it would also help with anxiety, but it's based on CBT. And what's cool about it is that you tell the patient that they're going to be linked to your account and that you can check on their progress, and it sort of gives that accountability. So I can see a patient in a month and then I can look back and say, oh, good job, you completed 3 out of 7 sessions. Keep going, you're doing good with that. Are you learning anything? And the feedback I've had from adolescents, I've had probably 30 plus patients do this, and they all have said good things about it. So I'll put that in the link.
That's awesome. How much is the cost?
It's free.
It's free. Wow. Okay.
Yeah, it's being piloted and studied right now. So that's the whole thing, is you sign up as a provider to pilot it. And then eventually it might be a paid app, but they're trying to get it to become covered by insurance as part of like a medical device application to the FDA.
Is there any kind of like safety net in that? Like, what if the kids are?
They don't ask
suicidal? Does that come
about
to your
suicide. So they do a PHQ 8, but not a 9. So they follow the patient's PHQ 8 score. And then of course there's links on there that, I mean, it has probably the suicide emergency information in there, but they don't ask if the patient's suicidal, I think, for that reason.
I have noticed though too, using the PHQ modified versus like just the PHQ 9, that our scores on our patients have increased some. And we have noticed that because of those last 3 questions. So it says, in the past year, have you been feeling more sad than even having happy days? I can't remember how it's worded because I don't have my questions in here with me. But those last 3 questions have really, they actually kind of, it doesn't change the scores, but it really does open up a window.
Any other questions about screening for anxiety or depression?
I'm curious, Dr. Olivier, do you, as a psychiatrist, do you use those screens, or do you just think about the DSM criteria and it's like somewhere in your brain and you use the DSM criteria?
For me, because it's going to be at the point that they see me, they're beyond the screening. So I'm going to do like a clinical interview, and in my head, I'm going through each diagnosis, like depression. I'm going through the DSM criteria as I interview them. Same thing with generalized anxiety disorder. I'm going through the DSM-5 criteria. Now, when I get to other anxiety disorders, honestly, I'll ask like a general screening question, like for social phobia, it'll be like, are you a really, really shy person? And if they say yes, then I'll go into the detail about all that. But no, I don't use a lot of the screens because I just got all the criteria somewhere in here. Even for like PTSD, I'll go through the DSM criteria for PTSD too. And there's a lot of overlap between diagnoses, so it's not like a formal checklist or anything.
Well, we want to thank Lisa for presentation, as well as Sienna. The next session we're having in a month is going to be about, okay, so you do the screens. So it's a follow-up for this session. You do the screens. Well, then how do you have that discussion with the parent or caregiver? Like the what's next after you get a positive screen? That's going to be the content of the next session. So does anyone that's participating today, or is anyone interested in presenting a case where you had you've completed a screen and you have the discussion coming up, or you have a question about how do you present this information to the parent that would then correlate for our case presentation next month? That'll tie in with the didactic. If anyone has a case that they're thinking of, or maybe you're considering providing one of the screens that Lisa talked about today, And we could use your case, discuss your case presentation to do some recommendations for you. Does anyone have someone they're thinking about that maybe we could help walk you through the case presentation for next time? Well, if you think of something, or if you consider, or when the session ends and you're considering it, are you thinking of a patient in mind? Even if it's not related to the topic of screening, we can you can reach out to yeah, Dr. Cargy, but you know that question about being shy in school. Well, we could also help get the information from you, and one of us can present it if you don't, and you could just answer questions that come up if it's about speaking in front of everyone. That's also an option. We understand that everyone may not be comfortable. So just expect the email, Dr. Cargy. So for our next session, it's going to be on Tuesday, August 8th. And Lena Reget, who is our licensed clinical social worker, is going to present. She's done mental health consultations with primary care providers for many years now. So she's familiar with the topic of helping providers walk through the follow-up following the screens, positive and negative. So we're going to also send out, like Dr. Olivier said, I'll send out the recommendations as well as the link for the CEU survey. It has to be done within 48 hours, so for you to get your CME credits. And so we're going to send that out to everyone following this, the end of this session. So does anyone have any additional questions or other comments that you'd like to make before we end today? We appreciate everyone's time and attention, and thank you for participating. We'll hang on for a few more minutes in case anyone wants to ask us something individually, but thank you and have a good rest of your day.